everyone, today I'm presenting my recently published integrative review in the Journal of Human Nutrition and Dietetics titled Examining Dietitians' Knowledge, Skills and Attitudes Regarding Working with Older Adults in Residential Aged Care Facilities and Home Care Services. I'd like to acknowledge my co-authors, Professor Wendy Moyle, Dr. Rochelle Rigby and Professor Lauren Ball. Just a little bit about me. So I'm based on the Gold Coast, Queensland, Australia. My undergrad was in nutrition and dietetics, and I'm currently an aged care dietitian, and I'm currently doing my PhD candidate at Griffith University. So just to provide a bit of background to this study, as I'm sure many of you are aware, Australia has an ageing population, and with older age comes increased risks of chronic disease, frailty, mobility and memory disorders. And we've seen, and we will continue to see, more older adults using aged care services in Australia. So in particular context to Australia, a recent report revealed that up to 80% of all individuals in their lifetime will use our aged care service. With the recent Royal Commission in the Australian context, they identified the need that allied health professionals should be employed in all aged care facilities. Australian dietitians governing body, Dietitians Australia, took this one step further and identified that all dietitians should be seeing residents in aged care facilities for at least 1 hour per month per resident. So this is consistent with some other countries as well. So then this really came to my study. So I really wanted to understand, what are dietitians' knowledge, skills and attitudes working in this setting, and are we ready for this potential work increase? So therefore the aim of this review was to synthesise evidence regarding dietitians' knowledge, skills and attitudes working in aged care services and home care services. So the inclusion criteria for this study included any dietitian or student dietitian working with older adults in residential aged care facilities or home care services, and it had to explore any aspect of knowledge, skills or attitudes. There was no restriction applied to methodological design, language, geographical location or year of publication. So as I mentioned, this integrated review was developed using the updated methodology. It was reported according to Prisma. It was screened and extracted in duplicate using the software Confidence, and it was assessed for quality using the Joanna-Briggs cross-sectional and qualitative study checklist. And the data was analysed using metasynthesis. So as you can see, we started with just over 8,000 studies, and a total of 17 studies were included in this paper. Publications range from 1986 to 2021, and they were conducted in 7 different countries, with most in the US, followed by Canada, Australia, UK, Israel, Japan and the Netherlands. And 12 of the studies included residential aged care facilities and 5 were in home care services. So coming to my theme, so what did we find? We found that dietitians have a strong sense of value. So they reported taking their role seriously, and they really valued their role within the clinical care team. The study of students identified that students went above and beyond to provide autonomy and dignity to older adults. The second thing was that dietitians felt a lack of role clarity. Roles and tasks were described as variable, ever-changing and multifaceted, and it was often unclear dietitians' role to other health professionals. They described their role as self-appointed and self-directed, and they said spending time with patients was their highest priority, but not always possible. And they rated themselves as dietitians less important compared to how other health professionals rated dietitians. The third thing was that all staff have a role to play in nutrition care. So dietitians recognise that nutrition is a team effort, and dietitians are totally ineffective without the nursing team behind them. However, referrals weren't always timely or requested, and dietitians often had to overcome misinformation spread by other health professionals. Dietitians felt that other staff were undertrained and that more training and education is required in nutrition in these settings. The next theme was that dietitians had assumptions and biases about older adults. So some dietitians had mixed views on whether older adults could actually make wise dietary choices, and others were unsure whether they could change their nutrition habits. Some dietitians described older adults as lovable and fun, where others described them as irritable, pitiable and confused, which is not ideal if you're wanting to work with the older adult population. And the last thing is that dietitians recognised the need to build capacity in the workforce. So dietitians reported lack of time, funding and professional development opportunities. 74% of dietitians reported insufficient time within the nursing home. And 5 studies reported that more job opportunities are needed for dietitians in these settings. They also identified that there was not enough sufficient paid time to monitor their patients effectively. So in summary, this study found that dietitians have mixed attitudes about working with older adults in residential aged care facilities and home care services. However, it was unable to conclude what are dietitians' skills and knowledge working in this area due to the lack of literature available. It's important to take caution when interpreting these studies' findings due to the low quality studies that were analysed. And where to from here? So this study identified a number of areas for future research or future considerations. The first one is that we really need to evaluate dietitians' role in aged care. We also want to review the education and training for dietitians. We want to explore practical opportunities for students and also assessing the impact of mandated dietitian hours. Thank you. So that brings me to the end of my presentation. Thank you very much for listening. As you can see, there's a screenshot of the recently published paper, and the QR code will also link you to that paper. And if you have any questions about the paper or my future research, please contact me.